Thank you, Janice. And thank you all for being here this morning. We're pleased to be issuing this new report, and the whole purpose of the report, as others have said, is to help policymakers, the general public, and you, the people who help policymakers, think about how to balance Social Security's finances for the long term and improve benefit adequacy. The work of this project is supported by the Ford Foundation's Initiative on Economic Fairness and Opportunity and the Rockefeller Foundation's Campaign for American Workers. Social Security finances have a very long time horizon, and this makes it different from many other public policy issues that Congress is facing. The projections go out 75 years. As Janice told us, when Congress last considered Social Security finances in 1983, it was running out of money. They acted in the near term to shore up finances. They also acted for the long term to schedule future reductions in benefits that would take place at that time way out in the future by raising the age at which full benefits would be paid to retired workers. They raised that age from 65 to 67, started to phase it in the year 2000 for people reaching 62 then, and fully phasing it in by for people reaching 62 in 2022. So essentially, anybody born in 1960 or later has this higher retirement age, which is equivalent to about a 13% reduction in retirement benefits at any age they are claimed. So this reflects kind of the long-range nature of worrying about Social Security finances. Today, as several people mentioned, Social Security doesn't need more money now, but policymakers could act now to schedule the money out in the future when the finances are needed to make sure that the benefits that are scheduled in law can be paid. And in fact, as Ken and others have mentioned, there is a concern today about benefit adequacy. That increase in the retirement age is not yet fully phased in, but we are seeing that there's a real, genuine need to be thinking about the adequacy of benefits. Next. A little background on Social Security, and I'll try to do this quickly. Who pays for it? I think most of us know workers and employers pay for it with a tax on wages. 6.2% paid by each, up to a cap that's $106,800. Also, seniors pay, or beneficiaries pay, income taxes on part of their benefits, and that money also, part of that money also goes to Social Security. And the third source of income for Social Security is investment earnings on reserves of the Social Security trust funds. That money is invested in Treasury bonds, and that interest on those bonds goes to the trust funds. And that interest is now about 14% of total income to Social Security. What is the financial outlook for Social Security? And this comes directly from the annual trustees report that's prepared for the trustees of Social Security by the actuaries at Social Security. Glad to know they're here today. They can correct any errors of fact or omission. But according to the latest trustees report, Social Security will be running surpluses for the next coming years. The latest report said through 2023, when we count both interest and tax revenue. And by then there will be close to $4 trillion, a little over $4 trillion in the trust fund. But that money then will be gradually spent to help pay future benefits until 2037, when the reserves would be depleted. But that means that there's still money coming into the system, and that money covers about 3/4 of the total cost of benefits then. So if we think about, so we're in good shape in the near term, but we're not in great shape for the last half of the 75 years. If you think about this shortfall as kind of an average over the next 75 years, it's about 2 percentage points of taxable payroll. That's a kind of a general summary number of what it is. In terms of the shortfall, it could be sooner, it could be later. The trustees do 3 sets of assumptions. Under the high-cost assumption, could run out of money about 8 or 9 years sooner. On the low-cost assumptions, the system actually is solvent for 75 years and beyond. Now, several people have talked today about why we need to consider benefit adequacy, and I would just like to recap quickly. As Ken said, because so many beneficiaries depend so heavily on it. The pie charts illustrate that so clearly. When you see all that green area in the lowest two income quintiles, in the middle income quintile, even in the next to the highest income quintile, that's people with incomes between roughly $29,000 and $50,000. Social Security is nearly half their income. So people depend on it. Second, as Janice mentioned, other sources of income are getting riskier. Pensions are in this savings account mode, which is not as secure, not as strong a promise that it will last the rest of your life. In the recent downturn, only Social Security has held its value. And the third point is, while people are very dependent on Social Security, the benefits are modest. The average retired worker benefit is about $14,000 a year. That's certainly important, but it's not a lavish lifestyle by any means. It's less than 1/3 of the average wage of all workers, and it's less than the full-time minimum wage that's now part of federal law. In our new report, we talk about some up-to-date measures of what it takes for seniors to make ends meet in a very modest lifestyle. And those studies find that one in good health, a single elder, needs about a little over $20,000 if he or she is paying rent. That's in a very modest lifestyle. May need about $24,000 if he or she is still paying for a mortgage. So what do we have to offer in the way of options to improve Social Security? There are many possibilities, and this report talks about only a few. Again, the purpose of this report is to begin a new kind of discussion about possibilities. The new report lists 11 options to make Social Security more adequate, and I'll be focusing on about 4 of those categories today. One targets widowed spouses, and while widowed spouses in old age, the Social Security generally has pretty favorable or pretty adequate survivor benefits relative to couples benefits when one partner was the main breadwinner. But for couples in which both the husband and wife had worked at low pay, the survivor benefits are less adequate. And there have been thoughtful proposals to improve benefits for those kinds of couples, low-income couples in which both depended on each other's earnings for their livelihood. And I'm pleased to say that the author of this proposal is actually here. Joan Entmacher wrote a paper for us, and thank you, Joan. There are also proposals for long-service, low-paid workers that aim to improve the special minimum benefit to keep retirees out of poverty if they've worked at least 30 years. And some proposals of this vein would also allow credit for child care for some years to count as work toward Social Security. This is beneficial particularly to working women who do not end up without the protections of survivor benefits from a husband. Another category are children of disabled or deceased workers. Social Security currently provides benefits to such children, but the benefits stop at the age of 18. One option would extend those benefits to the age of 22 if the child is in college or vocational school. Again, the idea here is to help fill some of the role that is lost when a parent's earnings are lost by helping to launch kids with a chance to better earning power throughout their adult lives.